Hi, my name is Emily Watkins, and I am a University of Michigan nursing student. The patient I will be presenting today is a 50-year-old Caucasian female who lives in an upper-middle-class suburb outside of Detroit. She is a married mother of 4 who used to work as a full-time biology teacher and now works part-time as a payroll accountant. Patient is 5'4" and weighs 140 pounds. Vital signs. Patient's pulse was 72 beats per minute and her respirations were 12 breaths per minute. Patient's blood pressure measured at 118/76. Temperature taken orally was 98.6 degrees Fahrenheit. Present illness. Patient was admitted into the ER on March 27, 2017, complaining of a sore throat. The patient reports presence of a stuffy nose for approximately 10 days, accompanied by green mucosal discharge. 3 days later, the patient experienced pain in the back of the throat, along with dull, achy headache, sinus pressure, and swollen glands. The patient does not report any signs of a fever. She describes her throat, her chief complaint, to be red and sore, rating her pain a 7 on the pain scale. Dysphagia is present. Patient's headache and sinus pain was rated a 6 on the pain scale. The patient drinks tea or coffee and takes ibuprofen to alleviate the pain, which helps for a short amount of time. Patient states her symptoms worsen early in the morning and at bedtime as laying down increases sinus pressure. Patient reports loss of sleep and feeling irritable, taking away from her daily duties as a mother and part-time worker. Medical history. Patient experienced severe ear and sinus infections as a young girl and continues to contract such infections sporadically as an adult. She has astigmatism bilaterally in both eyes, and the patient reports her condition worsens with age. 5 years ago, patient experienced kidney stones and passed all stones with no further complications. She was admitted this past year for ovarian cancer involving a laparotomy, a cystectomy, followed by a full hysterectomy. The patient has fully recovered but returns to the oncologist for routine scans and blood work tests. Immunizations. Patient is up to date with her immunizations, however, she did not receive a flu shot for this past flu season. Allergies and drug reactions. Patient is allergic to nickel, bees, and sulfa in most cold medicines. She explains that when nickel touches her skin, hives break out in the area of contact and her skin becomes itchy. Symptoms of the patient's bee allergy include swelling, rashing, fever, and obstruction of respiratory airway. Sulfa brings on itching and a slight rash. Hospitalizations and surgery. Patient was first hospitalized at age 5 due to a bee sting. She was discharged the same day. The patient experienced a tonsillectomy at age 7 due to tonsillitis. At age 11, she was admitted to reset her nose as she broke it playing softball. When the patient was pregnant at 30, she was admitted due to premature labor and stayed for the duration of almost a month. At age 45, the patient was admitted into the hospital for severe abdominal pain. After tests, she was diagnosed with kidney stones. This past year, due to ovarian cancer, the patient had a laparotomy and cystectomy followed by a full hysterectomy. She continues to return to the hospital every month for blood work testing and routine scans. No signs of a relapse are present thus far. Patient is taking no current medications. Health habits. Patient does not drink alcohol, smoke, or use recreational drugs. She identifies as a vegetarian and states she only eats clean and organic foods. The patient claims to exercise twice a week on average, focusing mostly on cardiovascular exercise. She drinks 3 cups of coffee a day and typically gets 7 to 8 hours of sleep each night. Psychosocial data. Patient is married with 4 children. She claims to be close with her mother and calls her daily. She sees her friends on a weekly basis and is an active churchgoer, identifying herself as a strong Christian. The patient graduated from the University of Michigan with a degree in teaching and taught high school biology for 15 years. She then stopped working to focus on her job as a mother until returning to work as a payroll accountant for a small local business. The patient's stressors include work deadlines, caretaking of an 11-year-old son, and worrying about her children and the health of her mother. Patient does not come in contact with environmental hazards daily. She reports that she is thankful for her strong support system and loving family. There is an absence of anxiety or signs of depression. Family history. The patient is at a high risk for heart complications. Her mother, father, grandmother, grandfather, and aunts were diagnosed with hypertension. Her mother also has a history of hearing loss and was an avid smoker during the patient's fetal stage of life. The patient's grandmother was also diagnosed with ovarian cancer and eventually died of liver cancer. Her aunt was recently diagnosed with breast cancer and is finishing her treatment. The patient's father had severe alcoholism and died of ALS. The patient's grandfather died of a heart attack. Review System 1. Head, eyes, ears, nose, throat. Because of her chief complaint of throat pain, as well as her complaints about sinus and mucosal discharge, a heat review is crucial. The patient explains she has been having dull, achy headaches between her eyes, although dizziness, fainting, and vertigo are not present. Her vision has become gradually worse due to aging and uses glasses to correct her deficiency. Glaucoma, cataracts, or existence of a recent injury are not present. The patient contracted frequent ear infection as a child. However, her hearing is as acute as her friends and family. Patient is experiencing mucosal discharge from the nose and down the back of her throat. Her last dental exam was just a week ago, and the patient got her eyes checked 2 months ago in January. Persistent sinus infections accompanied by a sore throat are relatively persistent during the colder months. Patient states dysphagia is present, along with tenderness in the neck due to swollen cervical nodes. The patient has not received radiation in the head-neck region. Head, eyes, ears, nose, and throat findings. Head and neck findings. The skull was round, symmetric, appropriate to body size, no tenderness with palpation, no deformities or lumps. The temporal artery is strong, 3+ pulse bilaterally. The patient's facial expressions are appropriate. The features and movements are symmetric, no involuntary movements, edema, lesions, or pigmentation changes. The head is midline. The patient's neck muscles are symmetric. The neck range of motion is smooth and controlled. Her trachea is midline, no enlargement of thyroid gland. There is some tenderness in the cervical lymph nodes, one enlargement greater than 1 centimeter of the left deep cervical node. Eyes and vision findings. The patient's eyelids approximate completely when closed, her skin intact without redness, swelling, discharge, or lesions. The eyelashes are evenly distributed and curved outward. Her conjunctiva is moist and clear with small blood vessels. The sclera is white. The cornea is clear with no irregularities. The irises are round and the same color. Her lacrimal apparatus is not palpable. There is no tenderness. The result of visual acuity was 20/40, but 20/20 with her glasses. Her visual fields are intact with no peripheral field loss. The patient's extraocular muscle function is parallel tracking bilaterally with no nystagmus. Her corneal light reflection of the light was a mirror image in the left and right eyes. After the cover-uncover test, there was no lateral or upward-downward movement of the eyes. Her pupils were reactive. Ear findings. External ears are symmetric in size, shape, color, and configuration. There was no swelling or thickening. Her skin was intact, no lumps or lesions. The pinna and tragus were firm yet movable, no pain with movement. The mastoid process was free of lesions, no pain with movement. The patient's external auditory canal was patent, free of discharge, no swelling or redness. After the hearing test, the patient could hear equally on left and right sides of the body. During the whispered voice test, the patient was able to hear and repeat each word and phrase correctly. The Rhine test tested positive. The patient could hear vibrations equally in both ears during the Weber test. During the Romberg test, there was no excessive swing or loss of balance. Nose and paranasal sinuses. The patient's external nose is symmetric midline in proportion to other facial features, no deformity, inflammation, or lesions. There is reduced patency in both nostrils. In the nasal cavities, the mucosa is red. There is presence of slight edema and green mucosal discharge. The septum is midline. The patient's frontal and maxillary sinuses are tender, some pain upon palpation. Mouth and throat. The patient's lips are smooth, pink, free of lesions and cracking. The TMJ joint has smooth movement, no tenderness or limitations in range of motion, no pronounced clicking. The buccal mucosa is pink, smooth, moist, with no lesions. The teeth are white, straight, evenly spaced, clean and free of debris or decay. Her gums are pink or coral with a dotted surface. There was no swelling, retraction of margins, bleeding, or discoloration. The patient's tongue is mobile, pink. The dorsal surface was more rough. The ventral surface is smooth, glistening with veins. Saliva was present. The floor of the mouth, there were no white patches, nodules, or ulcerations. Her hard palate was white with irregular transverse rugae. Her soft palate was pink, smooth, and upwardly mobile. The patient does not have tonsils due to a tonsillectomy. When testing the hypoglossal nerve, the tongue protrudes in the midline, no tremor, loss of movement, or deviation to the right or left. When testing the glossopharyngeal nerve, the soft palate and uvula rise in the midline when the patient says ah. Her gag reflex is intact when testing the vagus nerve. Review System 2, Cardiovascular. Because the patient has a strong history of cardiac implications, a cardiac review is important. The patient does not report any chest pain, arm or jaw numbness. She has no history of hypertension or a murmur. However, she claims that sometimes her heart flutters when she is under extreme stress. The patient's exertion tolerance has not changed and can walk several miles without becoming distressed. She does not like to lie flat, however, and uses several pillows at bedtime. No palpitations were present. In the patient's peripheral vascular system, pain in legs, thighs, and hips when walking is not present. Edema, coolness of hair, or hair loss in the extremities is also not present. Veins are becoming more present with age on the thighs of the patient. There is no history of blood clots in the legs. Cardiovascular findings. During the cardiovascular assessment, the patient's chest contour was 1 to 2. Symmetrical and symmetrical in expansion. Cyanosis was not present. No heaves or lifts observed. After palpating the PMI, aortic, pulmonary, Erb's point, tricuspid, and apical areas, no palpable heaves or thrills were present. When auscultating all areas with diaphragm and bell, and sitting in supine position, S1 and S2 were heard. No S3 or S4 or murmurs were present while patient was sitting, lying, or on the left side. During the peripheral vascular assessment, the patient's skin was pink, warm, and dry. No viscosities were noted. The patient's hair was normally distributed. No edema was present. Small 3 cm by 3 cm reddened area on the right heel, however, no other reddened area or ulcers were present. Carotid, temporal, radial, brachial, femoral, popliteal, posterior tibial, and dorsalis pedalis pulses were present bilaterally at 2+. Capillary refill on upper and lower extremities were less than 3 seconds. No edema or signs of DVT were noted. Pertinent System 1. Because of the patient's history of ovarian cancer and the strong family history of ovarian cancer and other reproductive implications, a genitourinary and reproductive review is worth investigating. According to the University of Maryland Medical Center, most ovarian growths and relapses progress silently. The patient has a metastatic ovarian cancer, which can spread to different locations in the body, such as the omentum and diaphragm. Ovarian cancer is the 5th leading cause of female cancer death, so it is imperative to schedule routine checkups. Because the patient had a full hysterectomy recently, reproductive assessment may be valuable valuable to reassure everything has healed properly. Pertinent System 2. Due to the increase of mucus and infection in the patient's sinuses, a neurological assessment would be beneficial, as chronic fluid can begin to build pressure along the brain and spinal cord. The patient reports of having frequent sinus infections. Typically, this is not an issue. However, chronic sinus infections can lead to meningitis. According to the Mayo Clinic, meningitis, an infection caused by inflammation of the membranes surrounding your brain and spinal cord, is a complication of chronic sinusitis. Symptoms of meningitis include severe headaches, sensitivity to light, seizures, confusion, and difficulty focusing. Though meningitis is not always a complication, because the patient deals with sinus and ear infections frequently, it is something to be mindful of when examining the patient. This completes my health assessment. Thank you.